as Dr. Marco said, uh, thanks for the great cases. I think we had 50 or so in the MSK section, and always hard to pick because you guys do such a great job. And it's only through your efforts that we're able to do educational programs such as this. So again, just thank you so much. So this was a 19-year-old with a past medical history of Lee-Fraumeni syndrome who presented with an enlarging mass for 5 months. And the physical examination showed a large posterior thigh mass that was firm and as well as tender. If we look at the scout views from the CT, we can see this calcified mass in the lower thigh. And on the CT examination, we can see the mass quite clearly as well in that posterior compartment of the thigh. We can see that the non-mineralized part is a little lower attenuation than muscle, but we see the focal areas of calcification quite nicely as well. On the MR, we can clearly see the mass again in that posterior compartment of the thigh with intermediate signal on the T1 weighted sequence. We can see the peripheral nodular enhancement on pre and post contrast, and then high signal intensity within the non-enhancing area. And we can see the focal area corresponding to the mineralization that's staying low signal on our water sensitive sequence as well. On our long axis image, quite similar features with, again, that large mass with the peripheral and septal enhancement, probably a little better shown right here. And again, the focal area of really low signal intensity corresponding to the area of mineralization. If we look at the gross specimen, we can see the area that was mineralized, the white chalky area right there in the circle. There is the areas of necrosis. And then the rest of the high water content material was really highly cartilaginous. And that's what we were seeing along with the necrosis showing peripheral and septal enhancement. That's similarly shown on the microscopy where we see the osteoid formation as the pink material, and there is the cartilaginous portion of this lesion also. And if we look at higher power, we can see that the malignant cells are producing the pink osteoid, as you can see here, and that's corresponds to our imaging. So this is just a constellation of the features in this unfortunate patient with Lee-Fraumeni, which predisposes us, we know, to lots of different malignancies, and one of them is clearly osteosarcoma. And so this was an extraskeletal chondroblastic osteosarcoma shared with us from Dr. Ryan Johnson. So thank you so much for that case.
Wonderful. What a beautiful case. Congratulations.